Hi, how are you? It's the beginning of the mental lecture. I am Dr.Gezira, an AI psychiatrist. This video was created under the supervision of Dr. Motofumi Fukabori, a Japanese psychiatrist, to explain mental illness and related psychology in an easy-to-understand manner. Let's relax and learn together.
Nice to meet you. My name is Catherine, the interviewer. Then, what kind of disease is depression?
When you feel depressed because your mind is tired, it is called state of depression. And a disease that continues to appear for more than 2 weeks is called depression. On the other hand, the state of being too enthusiastic is called manic. And the disorder of repeating mood changes in both depression and manic is called bipolar disorder. Depression is by no means a lazy disease. It is a definite brain disease. It is also expressed as a cold in the heart or pneumonia in the heart because anyone can catch it. It is also very important that depression is a mental illness that causes suicide.
What are the characteristics of a person who is likely to become?
They are too meticulous and serious, thorough-minded, honest and righteous, responsible, sensitive to the other person's feelings, caring for the situation, trying too hard, and have no hobbies. Isn't there a lot of people who apply?
I think it applies to me, too. What is the cause of depression?
Excessive stress is said to be the main cause of depression. In any case, modern society is under a lot of stress. In a performance-oriented society, free competition, and globalization, both companies and workers are being driven into a situation where they cannot be spoiled. Like the fear of unemployment following the collapse of the lifetime employment system. There are many things, such as not being rewarded with rewards and evaluations. The main causes are self-denial, self-confidence, and accumulation of such stress.
How many patients have depression?
According to WHO data, 350 million people worldwide and 1 in 14 to 15 Japanese suffer from depression. 1 in 10 women experience depression. It's twice as much as a man. Therefore, it is estimated that there are approximately 3 to 4.5 million people.
There are more women. What are the types of depression?
There are a lot of them, so I'm going to give you 12 examples. The first is physical depression caused by physical illness. Second, endogenous depression with no obvious cause. The third is reactive depression caused by key experience. Fourth, psychotic depression, with paranoia of poverty and paranoia of self. Fifth is seasonal depression, due to seasonal changes in sunlight. Sixth, postnatal depression, maternity blue, often transient, found in about 5% of mothers. The seventh is menopause depression, due to a decrease in estrogen during menopause. The eighth is drug-induced depression, hypertensive drugs, oral contraceptives, steroids, etc. The ninth is neurotic depression. Although the symptoms are mild, they are prone to chronicity, which is common among young people. It accounts for about 40% of depression. The 10th one is moving depression. The 11th one is promotion depression. Number 12 is depression in children or adolescent depression, irritating or irritable. There are many other types of depression.
You can see that it is a disease that is relatively hidden in everyday life and can be contracted by anyone.
Do you know any famous people who came out with depression?
I don't know.
There are actually many famous people in history. The famous one is Churchill, who was Prime Minister of England. The episode that he called his depression "My Black Dog" is famous. There are many other great men who have been revealed to have suffered from depression. For example, Michelangelo, American literary Hemingway. He killed himself with a shotgun with the delusion that he would be arrested by the FBI. Other writers are Tolstoy, Balzac, Goethe and Camus. Among Japanese, Osamu Dazai and Kenji Miyazawa Motajiro Kajii are famous. The composer is Tchaikovsky, and the scientist is Darwin. Also, there are a lot of people who came out of the entertainment world saying that they had depression, with Audrey Hepburn, Lady Gaga, Brad Pitt, Angelina Jolie, Jim Carrey, Halle Berry, and Robin Williams who committed suicide. Also, there were many Japanese people who came out of the show business saying that they had depression. Miho Takagi, Tetsuya Takeda, Yusuke Santa Maria, Takashi Okamura, Nanakumi, Masayuki Watanabe, Miki Maya. There are many famous people.
What are the specific symptoms of depression?
Depression shows symptoms in the mind and body. In some cases, only the symptoms of the body appear first. So at first, there are overwhelmingly many patients who go to internal medicine, brain surgery, obstetrics, and gynecology. For example, headaches, stiff shoulders, perspiration, palpitations, stomach pain, diarrhea, constipation, and general fatigue. The mental symptoms of depression are neither motivated nor energetic. You can also lose interest in what you've been looking forward to. I don't want to see anyone. I don't want to talk. I don't want to see my family. Your concentration and memory will decrease, and you will make more mistakes at work. When depression becomes severe, the movement becomes slow. The decision becomes weak, and the efficiency of work becomes poor. They are misunderstood as being lazy. There are times when you can't stay still because you have a strong feeling of anxiety and impatience. Depression patients don't think it's because of the disease, but blame themselves and push themselves harder, saying, "It's because I don't have enough effort. I have to work harder. I'm scared," because when they feel more worthless and self-responsible about themselves, they feel like they want to die or feel better when they die.
What kind of treatment is there?
There are 3 important things to treat depression. First of all, take a good rest and rest your mind and body in a relaxed mood. If possible, it is necessary to take a break from work. Next, continue medication centered on antidepressants and anti-anxiety drugs. The third is psychotherapy that psychiatrists use to work with words. Recently, cognitive behavioral therapy is also used. In any case, you'd better think it's 6 months to a year or longer. Also, I want you to know that the recurrence rate is high even if it is cured once.
What should people around patients with depression pay attention to?
First of all, you should never scold or encourage others. It's important to watch with the attitude of, "You can relax."
I see. I got it that I was able to feel close to depression. Thank you for the easy explanation today.
Was it helpful for everyone? I will continue to speak out to help you have a better day.
I would appreciate it if you could sign up for a high rating and a channel.
See you in the next video.
Goodbye.
Goodbye.